Telemedicine and telehealth platforms and solutions are pretty widely deployed these days. At Dialogue, you've got a forward-looking mobile app-driven solution that links healthcare professionals with patients in need. How does your platform work?
Dialogue is the leading telemedicine provider in Canada. And the way it works is that an individual would contact Dialogue through an app and speak to a team of medical professionals within minutes. So doctors, nurse practitioners, nurses, care coordinators, for any health question they might have for themselves and their family members. It's a benefit that's offered by their employer to themselves and their families.
The employer is your customer, and from the employer's perspective, there's a big productivity loss when people are taking time off work and waiting in an ER or waiting in a general practitioner's waiting room for an appointment.
On average, a patient that consults on the Dialogue platform would save around 4.5 hours. And so multiply that by their salaries and multiply that by the number of consults that can happen at an employer over a year. It can be thousands and thousands. The savings are huge.
As part of detecting early and creating preventative solutions, you've developed an artificial intelligence and machine learning triage type application. What does the triage application do?
When we have incoming patients, we have them go through a rigorous and smart questionnaire that adapts based on their answers. And the goal of that is to make sure that we create a rigorous medical story that is then reviewed by a doctor. And the goal of it is to remove human bias in diagnostics. And so we never forget to ask any question, even rare questions that could lead to rare diagnoses.
So when you think about the future of Dialogue, obviously people today are talking a lot about preventative medicine, reparative medicine, regenerative medicine. What does the application and use cases look like for Dialogue in this regard?
Preventative medicine is definitely a direction in which we're going, and something we even do today. We have a mental health program that was developed in order to capture patients that are starting to suffer from increased stress, anxiety levels. We try to screen as many patients as possible. And with that screening that is based on widely known medical questionnaires and anxiety, stress, and depression, we're able to see which patients actually fall into the category where treatment would be required. And these patients are the ones that do go through a treatment. So what we offer them is a multidisciplinary team that follows that patient and adapts to a patient's situation to bring them to remission as quickly as possible.
So as their condition evolves, they're getting varying levels of care or different types of care.
That's exactly it. So someone might need a therapist or a physician or a combination of the two. We have a case manager that follows up with patients every single week to make sure that they are improving or that they're doing their homework. And we know that when issues are caught early in the process, they can be solved much more rapidly. And so I think that's the direction of where medicine is going, is being able to use data in order to capture issues much earlier in order to provide the right level of treatment down the road.